All right, our patient is having Deuk laser disc repair done for herniated discs in her back. Now she has a herniated disc at L5-S1, and that's definitely contributing to her pain. Shot.
Let's fix this one.
But she also has, can you help me here?
Yes, sir.
She also has other issues going on, which we're not going to discuss, but they have to do with her muscles. And
That's good. Thank you. Yeah, that's good.
she, that's not being fixed today, but we've already talked about that. Our focus is fixing the L5-S1 disc because we know she's got a herniation at L5-S1. Shot. And the herniation's on both sides. And she's having horrible pain in her lower back. Shot. Just lay still, you're fine. Shot. Now, of all the discs in the lower back to get to, the L5-S1 is always the hardest. Shot. We're very close, but we're just a little bit off. Shot. I have to make an adjustment. Shot. Think we're good. Shot. All right. When I say shot, what I'm really asking for is to take a picture with the x-ray machine. Go ahead, give me an AP. And you can see the needle is right there at the L5-S1 disc in the back. And we want to go through the foramen, which is in front of the facet. Looks good. Let's go back to a lateral. So we're going to switch our views between front, back, and side to side. And that view we just took right now is a front back view. And you can see we're very close to the disc. Jordan, will you point to where the back of the disc is? We're going to use our marker there. You all see the little white arrow? Henry?
Yeah, we see it.
That's the back of the disc. All right, very good. Shot. 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 So that's L5-S1, and it's looking pretty good. It's pretty collapsed. There we go. Very good. So we're in the L5-S1 on the left side. Now we need to get left 4-5. Everybody agree? Left 4-5. Pumps ready, folks. Let me just give a little more numbing medicine first. She seems to be really comfortable. I'm very happy about that. I'm going to give her some more numbing medicine because we're about to cut the skin, and that can sometimes be painful. That said, let me go to the other side and give a parallel injection on the other side. And this medicine I'm injecting under the skin is a Novocaine with a little epinephrine, designed to prevent bleeding and also to deaden the nerves for temporarily in the skin. That way the patient doesn't feel the cut, because we are making an incision. Now this incision is 7 millimeters. It's not big, it's tiny. And the reason we can make such a small incision is because we're going to do this surgery endoscopically. That means we're going to use a tube, we're going to use a camera. I'm going to go inside that disc and I'm going to fix the disc from the inside. The beauty of this surgery, just lay still, you're okay. Let me have some numbing medicine. I'm going to give her a little more numbing medicine. You're okay. Just lay still, you're doing great. Everything's okay. I'm just giving you some more numbing medicine. Okay. Now we're using a combination of local anesthetic along with general, not really general, but more systemic anesthesia. That's propofol that we're going to be using. Shot. A little too high. Shot. Much better. Shot. So people ask me, is the patient awake for the surgery? The answer is yes, partly, especially in the beginning. Just relax. Shot. Very good. So I'm up against the facet joint at L4-5. We're going to slip just past it. Shot. Beautiful. So far, so good. Everything's going her way. Shot. I feel the herniation. You can actually see it there. That's L4-5 we're in now. I'm going to go in a little deeper. Okay, now we've got to get in on the right side at L5-S1. Remember, L5-S1 is the hardest one to get to. All the other ones are easy compared to L5-S1. Right, Luis? Oh, you're supposed to say they're all easy for you, Dr. Deuk. Shot. All right. I think we're a little further away than I want to be. Shot. 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 I want to make this as perfect as I can. You got my hand in there. Shot. Yeah, that's better. Shot. Let's get an AP. Let's see where we are. Now we're pretty close with the second needle at L5-S1. I'm going to need her awake in about 4 minutes, maybe 3 minutes, 3 to 4 minutes. All right, we're pretty darn close there. I like that. Back to a lateral. Nice job, Jordan. So the nice thing is our patient has a beautiful spine. You know, we can see the anatomy well. And shot. 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 She awake?
How you doing, sweetheart? You okay? Yes, she's awake.
Any pain down her leg?
Do you have pain down your leg?
AP?
Or is it in your back? Where is it? What?
Where is it? But she's responsive? Yeah?
Yeah. Where's the pain? In your back or your leg? Huh?
All right.
No, like switch legs. You said back.
In her back. All right, good.
No, sitting on and this one. Yeah. Yeah. You just have to say back and leg, okay?
Just want to be 100%. Totally responsive, right?
You doing okay?
I can rely on her?
She said yes.
Okay. Feels like I'm on the back of that disc. It's very collapsed. Shot? Well, let's try again. Shot? Shot? Yeah. Huh? Shot? You're doing great. Shot? Shot? Where do you feel that, sweetie?
Back or leg? Huh? Back? Huh?
Shot?
She just said back, she feels it.
Shot? 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 You're doing good. Just bear with me. I'm almost done. Shot? That's the facet. Just need to redirect. Shot? So we're sliding shot underneath it. That looks good. Shot? Shot? There we go. Perfect. That's the right way, right there. All right, I need a reliable. So far, folks, we've lost, honestly, we've lost probably 3 drops of blood. Now, it takes 20 drops to get to 1 cc or 1 mil. Most spine surgeons doing 2 discs will lose about 300 mils. We've lost 1. I'm sorry, we've lost less than 1. We've lost 3 drops. So 3 divided by 20 of a mil. Are you awake? All right. Now, this young lady is visiting us from South Carolina with her family, and she came to Deuk Spine Institute here in Orlando, near Orlando, in Melbourne, Florida, because she has back pain. She's got 2 discs, the L4-5, that's got a small herniation, very small, and then she's got a bad herniation at L5-S1 on both sides, left and right. You okay? Yeah, just lay still. You're doing good. We're going to be done soon. Just bear with me. Are you comfortable? So I need her to tell me if she's feeling pain at the disc that I'm going to operate on. Are you comfy?
She said yes, she is.
How bad is that? On a scale of 1 to 10, how high did it go?
10?
I heard 10. Is that where you get pain typically? Beautiful. Thank you. I'm so sorry. It's 10 out of 10, and it's concordant, folks. Awesome. That's what we want. We want that disc that we're about to fix to be the one causing her pain, and we just proved that it is. So, great news. Are you okay? She said, yeah. Now, when I injected the dye for the discogram, it's important you don't tell the patient you're going to inject. You don't want them tensing up or getting anxious. So it has to be as a surprise. Otherwise, it's not really a true test. You don't know. It could be just responding because they're afraid. And it's like somebody saying, I'm going to punch your arm, and then they bring their fist right next to your arm, and you're like, oh, 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 oh. Right? You haven't even hit him yet, right? So you want to get the discogram done when the patient doesn't know it's going to get done, when they're comfortable, when they're not having any pain. But we've just confirmed that that bottom disc is a 10 out of 10. When I injected it, you could see her back arch up, tighten up, all the muscles tighten up because she was feeling it. So that's a good sign. That means when I'm done with the surgery, that pain will be gone. Are you okay?
She said yes.
You can tell she's nice and relaxed. All right. How bad is that?
What number is that? She said a 10.
Really? That one a 10 too. She's got a small tear there. Very small, but she definitely has a herniation on the left. That's a 10. Interesting. And she definitely responded. All right. Let's go ahead and put her to sleep. When you wake up, we'll be done with your surgery. What do you want to start with, Luis? We're going to start with the top disc, which is almost normal. I'm excited because this means, let's get a picture. You never know where someone's pain's coming from until you treat the source and it goes away. Then you know where it was coming from. But the second best test for back pain and a herniated disc is a discogram, what we just did. An MRI won't tell you where someone's pain's coming from. The physical exam won't tell you exactly where the pain's coming from. That's why I use the MRI and the physical exam to make the best determination. But when you do a discogram and the patient has their typical pain, you know that disc is the cause of their pain. Shot? So that is the best test available in the world to know if a disc is causing someone's back pain. You want me to wait? Now it's interesting that this 4-5 caused so much pain. Normally it looks pretty well preserved, but there's definitely a herniation. I could see it on the MRI. It's not as evident as it is on the MRI as it is here. It's not as evident as the MRI. Shot? So now we're entering the disc that we're going to repair. I have a feeling this disc is going to be under pressure. if I had to guess. Because when I see discs that are painful, that don't have a huge tear, usually they're under pressure. I think this is one of them. Shot? It's kind of pushing this dilator back a little bit. Let's see. Oh yeah, look at that, look at that. Look at how much pressure it's under. Look, no. You got to show everybody. That's crazy.
We see it.
That disc just shot right out of the tube. And here's the best thing about it. I knew this woman was a patriot. Look at that. Red, white, and blue. You guys see that? That's the best.
Wow.
Can you see it?
Yes, sir.
Red, white, and blue. True American right there. So, I've never seen that. That shot right out. That disc is under a lot of pressure. Fascinating. All right. We were just talking about this earlier. Inflammation of the disc can be very painful. It's called discitis. Shot? So I'm going to go in there. We're going to remove some of this degenerated disc. It's causing all these symptoms. Look at that. All right. Any questions from our audience?
We don't have a question, but we do have a message from Reiko Pilot on YouTube.
Reiko Pilot. Yes.
They said, I just want to share with the audience and Dr. Deuk and staff, I am home safe. I was the first surgery of today. I've taken no medication and I am pain-free. See you tomorrow for post-op.
Yay! God, it's crazy, isn't it? We're doing our last surgery at 4:30, and the first surgery for today, she's called in and told us that she's back home, she's doing fantastic, and she's pain-free. She had 3 discs operated on. All 3 herniations were repaired. Her surgery went perfect. She was our first surgery this morning. I am so happy for you, and I really look forward to seeing you tomorrow. Have a wonderful night from all of us here at Deuk Spine. That's incredible. How many surgeons in the world get a call from their first surgery, during surgery, later in the day, to be told that their patient's doing fantastic? Very, very happy about that. By the patient. Wonderful, wonderful, wonderful. That's why we do what we do. All right. So this patient, again, is from South Carolina, and she's been suffering with back pain for how long? Anybody know? Well, it's been a while. It's been for a while. I don't remember exactly how long. But when I saw her, she told me it was right there in the lower back, right at L4-5, L5-S1. And I looked at her MRI, and I could definitely see the herniated disc, degenerated disc there. And I knew that disc, L5-S1 and L4-5, they were causing her pain. I just knew it based on all my experience. And I knew we could fix it for her, so here she is. Laser? All right. Let's hope her surgery goes just as well as our first patient. All right, now this laser fiber is 1 millimeter thick. It's twice as thick as the one we use for cervical spine. We have to use a skinnier one for the cervical disc because we have a skinnier endoscope, don't have as much space. And the cervical discs are smaller than lumbar discs. That is a known fact. The reason for that, folks, is they don't bear as much weight as the lumbar discs do. Lumbar discs bear all the weight of your entire body above your belt line, whereas cervical discs only have to bear the weight of your head and your arms and whatever you're carrying. So cervical discs are smaller than lumbar. Therefore, the scope I use for cervical is also smaller. Incredible. This disc, most surgeons would have ignored this disc. I'm going to tell you that because on MRI, you can look at it right now at the bottom of your screen. It's not that bad looking on MRI. But when I saw her pointing to this L4-5, and I looked at that MRI and I saw a small herniation. I knew this had to be painful. We just tested this disc and it was a 10 out of 10. So I was right. The problem is most surgeons wouldn't even consider this disc as being a problem based on the MRI. And there's the tear right there. And that's why you cannot rely on MRIs. They can only give you part of the picture. So when people out there ask me, look at my MRI report, tell me what I need done, I say I can't do that. I cannot do that. It won't do you any justice. I didn't build my reputation as successfully treating back and neck pain, curing 90%, 95% on average with guessing. I got to use all the information I can get to give the right diagnosis and provide the right treatment. So that's why it's important to do a physical exam. Got to do a physical exam. Too many doctors moving away from physical exams. They don't do them anymore. They think that all these fancy tests are going to give them the answers. Well, they don't. Believe it or not, when it comes to back pain, a simple physical exam is the most important test you're going to do. I didn't believe that, by the way, for years when I was being trained. You always hear the attendings, the ones who have a lot of experience. They talk about how important the physical exam is. And you're like, yeah, you old timer, whatever, right? But that's exactly right. The physical exam is important. And all these tests that we have, the MRIs, CAT scans, EMGs, none of them are as important as the physical exam. It's almost become it's become a lost art, you know? Doctors don't know how to examine a patient for back pain.
My son never got examined. Even though the examiner was his pain doctor.
You serious?
Never got examined. Even me in the room. With me in the room, he wouldn't examine me. He sent a big bill though. For 2 minutes.
Really?
Huge bill.
Did your insurance pay it?
I never saw a bill.
Well, I'm sorry to hear that. Well, I think she's what?
Okay.
What?
I don't mean to interrupt,
Oh.
but
But what?
so our last patient's feeling really well. He's lost a lot. He's voided twice, ate, drank something. He's wondering if he can go home. He just wants to lay down.
Yeah, you can go home.
You good with
He's
him?
got his medications.
He's got his meds. His pain's tolerable.
He's got my phone number. I know that.
He's staying very close by to
Yep.
mom. So
Yeah, the last surgery, he wants to go home. He doesn't want to wait. That's fine. I've already seen him. So, all right. Well, yeah, so this will be our last patient here at the facility. Huh? Cleaning out the recovery. Yeah, so I really am excited for this patient because she's got so much going on in her life and lots of it I can't fix, you know, issues. And I know that just getting rid of this lower back pain is going to make a huge difference for her and her family. And that makes me so happy to know that we're going to be part of that. My team is going to be the reason why she's going to be feeling a whole lot better. You know, life is hard enough without suffering with chronic pain. I would know. I've got teenagers. They try to make my life as difficult as they can. Teenagers don't seem to care whether or not you're having a bad day. Huh? I know some of you out there have teenagers. You know what I'm talking about. All right, just about done. So this was an interesting one. Not a big tear, real small tear. But man, was her disc under pressure, under a lot of pressure. And now we popped it like a zit. And now it's going to heal and it's going to feel a whole lot better. So we're pretty much done. And look at how that looks. You see that small hole? That's the tear, you know? So normally we see a giant tear, but this one is a small one. And I'm happy with that. All right. Any questions so far?
No current questions.
Beautiful.
We good?
Yeah, we're done with that one.
All right, let's go
That was an easy one. Someone must have hit the easy button on that one. Right?
Please, thank you. Stand by.
So we're just doing a little antiseptic. A little crankcase oil. Gonna irrigate it out. Our antiseptic we use in honor of NASA is betadine, developed by NASA, our government, to kill any kind of microbes, suspicious things that might be lurking out in space or in the operating room. All right, wonderful. So we're done with L4-5. Next on the hit list, L5-S1. And our last patient we just heard is ready to go. So he's leaving. He was the 4 level. We did L2-3, L3-4, L4-5 bilaterally. All right, why don't you run the video for our audience so they can understand why do people get back pain when they have a herniated disc? What is it that causes the back pain?
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
Welcome back, Shot. We're getting ready to start the Deuk laser disc repair on the patient's right push L5-S1. And then we're going to come back to the left side and do the left L5-S1. Now you've watched the video, so you see why a tear in the back of the disc with a herniation can actually be so painful, right? And that's what we're fixing with the Deuk laser disc repair. We already numbed this side up pretty good. So now why don't we show them the video of what the Deuk laser disc repair does to fix those tears and get rid of pain. Not really?
We put 2 dilators at the same time. That case opens space.
Oh, this space is going to open. I'm not worried about it. Yeah, getting in the space is not a problem. I just want to keep applying pressure while I do this side. All right. Shot. Shot. So we're at the L5-S1, which is the one we're going to fix on both sides. And I'm literally spreading open the disc space. Shot. And pushing the herniation back in. It's wonderful. This technique is incredible. So at the same time as I'm going through the tear, I'm pushing the herniation back so that I can take it out from inside the disc where it's safe. And I'm opening the disc space. Shot. Keep the pressure on that guy.
Yeah, yeah.
All right, that looks pretty good. Take it out. Any questions from the audience? Are we back?
Yeah, we're back. But yeah, no current questions though.
Keep pressure. So the audience, keep pressure, keep pressure. So the audience now has seen what's causing back pain when you have a herniated disc and how the Deuk laser disc repair works, correct? By debriding the annular tear.
We showed the back pain video, but we didn't show the...
We didn't show the DLDR video?
No, not yet.
Let's do that.
Okay.
Let's show them how this procedure works to get rid of back pain. Why it works.
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. Luis and I are just talking about the pros and cons of different types of irrigation systems for endoscopic surgery. And now you're saying the system we've been using up to now, huh? It works.
Before we used it.
But there's no motor though.
There's a little motor that actually inflates the back to create the pressure on
Oh,
the
I thought you
back.
used a.
Oh, no. Everything okay, okay?
Oh, so there's a motor.
450 on this, yeah?
We haven't gone to 150.
Yeah, there's a motor.
Have we gone to 150 on this?
No,
Should we try
can
150?
you try 150? Yeah, that's good.
Why not? Really? That's pretty good, actually. Right there, that's pretty good flow, right? That's a little better, for sure.
I was just curious how this thing was saying.
You're right. No, you're right.
I mean,
That's
the reason that I like it is just it's so compact. We have more space there. It's easier for them.
you like it,
Quiet. Yeah, it's
and he's
quiet.
willing to let us have the pumps,
They want. We're gonna have 2 pumps.
right? We just have to buy the tubes.
Yeah, but we can negotiate that.
We can negotiate. I'd hate to be on the other side of the table negotiating against Luis. Luis is quite the negotiator.
You should see me with Mark.
I'm sure. You were telling me. I appreciate that. Well, all right, Luis, I'll let you choose. I like it. Yeah, good. You see look at the tear in this one, guys. Totally different than the last one. You got one end of the bone right there, one end of the bone right there. The whole disc is torn, and all this blue stuff is the herniated disc stuck within the tear. So I got to pull back a little so I can get to it. Now we could use what's called a side-firing laser, but they're very expensive. They're $1,000 a piece.
2,000.
2,000. Jeez.
Not reusable.
and they're not reusable. So we literally would blow $2,000 on a side-firing laser, which is totally unnecessary.
You might hit your tube, or damage your tube more than
You're not going to hit your tube.
the side fire.
Talking about a neurosurgeon here. Maybe some other schmuck would hit the tube, but not me.
We know 'em.
No, but what we're saying is the laser we use now, straight firing, does a better job, in my opinion, because the side firing degrades over time in terms of the power. Plus, it's harder to see what you're doing with the side firing. And I've always used the straight firing laser. And I know the Koreans use the side firing for theirs usually.
They like it better.
Well, I don't know. I don't think it's better. I think there's disadvantages to it. For example, the side firing has a big head, like a huge cap. And when you're trying to hit the disc, you're pushing down against the dura and the spinal cord to side fire.
Right.
Whereas with the straight firing, I'm able to get everything straight on without having to put any pressure on the spinal cord. Yeah, so it's safer. In my opinion, it's safer. There's definitely, for cervical, spine, advantages of straight firing. I've tried the side firing a long time ago, but it didn't work. Yeah. Is everything okay, guys?
Yep. We're just talking about
Some inflammatory tissue there. You can see the pinkish red stuff. It's granulation. So my feeling is this patient's going to have her back pain gone tomorrow when she comes back to see me, and before she heads back to South Carolina with her family. I feel really good about it. And I think her leg pain's going to be gone as well. All right, if you enjoy Deuk Spine Institute's broadcasts, you may also enjoy our free app. The app is available on iPhones as well as Androids. You just go to the App Store and select the Deuk Spine Institute app because it is free, and download it to your phone. You can also watch live spine surgery through there. You can check out our library of terms and conditions. You can even request a free MRI review through the app. Will you just do a little announcement on the app there, Henry?
Oh, you did. We're all good.
All right, good. So let's show the audience what happens if you don't get the Deuk laser disc repair and you get a fusion instead. Let's show them the video that will compare the two surgery options so they can see that.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a half an inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the secured vertebrae. Cross-links are added to bridge the rods together for additional stability. Fusion hardware, by design, is to fuse joints that normally move, preventing natural movement in the damaged portion of the spine. Whereas with the Deuk laser disc repair, there is no loss of movement. Normal movement and flexibility of the disc and joints is preserved. The Deuk laser disc repair patient is soon back home, enjoying life, with a very fast recovery, allowing normal activities without pain. Meanwhile, bone graft material is placed throughout the fusion surgery site. These morselized pieces of bone will eventually grow together to help promote the fusion process. Prior to closing the wound, a temporary drain is installed to allow excess fluid to drain. Average surgery time of a traditional 2-level fusion is 2.5 hours, with an additional 3 to 4 hours in the recovery room. As we've seen, in comparison, a spinal fusion requires a much larger incision and results in a significant amount of scar tissue. The Deuk laser disc repair's 1/2 inch incision leaves no scar tissue around the spine or nerves. A large amount of bone is removed with a spinal fusion. With the Deuk laser disc repair, no bone is removed. Each disc is accessed through a natural opening in the spine. The entire disc is completely removed in a spinal fusion, even though only 5% may be damaged. The Deuk laser disc repair leaves the normal parts of the disc in place and removes only the painful annular tear on the damaged disc. Fusion requires hardware, including screws, rods, plates, etc. The Deuk laser disc repair does not require any hardware. The patient is totally hardware-free. Fusion surgery is very invasive. Cutting and moving the muscle structures and tissues for a spinal fusion causes trauma, resulting in permanent damage to the muscles. Whereas with the Deuk laser disc repair, there is no damage to the muscles. The Deuk laser disc repair is the least invasive surgery available to repair a damaged disc. With spinal fusions, patients are required to take highly addictive narcotic painkillers, which can cause constipation, bowel, and bladder complications. Due to the minimal pain, narcotics are not needed with the Deuk laser disc repair. Spinal fusions have a high risk for infection. The Deuk laser disc repair has a very low risk for infection. In the 7 years the Deuk laser disc repair has been performed, there have been no infections. Spinal fusion surgery has a very long recovery and requires a great deal of physical therapy and time to heal from the trauma in the muscles and the spine itself. Whereas the recovery from Deuk laser disc repair is in a matter of hours or days, rather than weeks or months. With fusion, the spine is being fused together, losing movement. Whereas there is no fusion with the Deuk laser disc repair. Normal movements of the joints in the spine is preserved. Spinal fusion results in loss of mobility. There is no mobility loss with the Deuk laser disc repair. In fact, most Deuk laser disc repair patients experience improved mobility after the surgery. The Deuk laser disc repair is FDA approved. All the instruments and equipment used are FDA approved. This proprietary surgery itself has been peer-reviewed and published and is performed exclusively at the Deuk Spine Institute. With the highest published success rate of 95%, the Deuk laser disc repair is proven to be the most successful and least damaging spinal surgery in the world for the treatment of symptomatic damaged discs causing back pain, neck pain, sciatica, and radiculopathy due to herniated, degenerated, or bulging discs.
Welcome back. We're getting a restaurant recommendation from Dr. Berndes. Ember and Oak. If you're in the Melbourne area where Deuk Spine is located, Ember and Oak. All right, we got to move south a little bit. And can you drop the fluoro to the ground a little, or are you all the way down? All right. So we are done with left L4-5, right L5-S1. And we're about to start left L5-S1. That way we do a bilateral L5-S1 and a left 4-5. And that's what's on the menu for this young lady. And I'm feeling really good about this surgery because I'm finding that there's herniations here that definitely line up with what has been causing her pain in her lower back and going into her legs. And I think that's going to be gone forever once she gets done with this surgery. I'm excited for her. She's been through a lot, her and her family. Shot. And I just want to give her some relief. The nice thing about this surgery is it gives permanent relief from the disc. Now, sometimes people develop other causes of back pain after the surgery. Okay, the most common being facet pain, F-A-C-E-T. The facet joints are little joints in the back of the spine, and they get arthritic. And when we fix a disc problem, we're not fixing a facet problem as well, unless, of course, we're doing both, which does happen in some patients. We can definitely do the surgery on both if we know ahead of time they have both problems. Some patients, though, we don't know they have facet problems until afterwards. Take. Go ahead. Beautiful. Oh, yeah. Now, folks who haven't seen this, we're doing the entire surgery through this little tube. It's called a tubular retractor. Now, if we were doing this surgery through a needle, it would be an endoscopic procedure. It would be a percutaneous procedure. But because we make an incision and we're using a tubular retractor and a dilator, this is no longer a percutaneous procedure. It's a real surgery. An open procedure. Uh-oh. I need fluoro.
What happened? I'm not sure. Always check the black box.
Shot.
Yeah, no, it's not there.
Shot. Shot. Sorry you guys aren't getting the x-ray feed, but for some reason it's not working. But we're going to have to keep going here. I can actually see it off the, there it is. I can see it off the monitor. Shot. All right, perfect. What was it, a loose wire?
I think so, because I just unscrewed it.
Well, there you go. Straight from Jordan's mouth, he had a loose wire.
The black box. Yes.
Surely there must be a question from our audience at this point.
Sargento, please.
If you don't ask me questions, I'm going to start singing.
Yeah, I'm afraid we don't have any questions.
You really don't want to hear me sing.
Can you do Wonderwall by Oasis?
What did he say? Oh, you're funny. You know, I'm like the worst singer in the world. I cannot carry a tone or tune. And my wife
Yes.
makes fun of me literally all the time. My kids make fun of me.
But you have a voice for the radio.
Yeah, I was a DJ. But listen, I know how to. We were playing karaoke. Look at that inflammatory tissue, the red stuff there. And there's a machine, a karaoke machine. It gives you a score on how well you sing the song, right? And I can make my voice deep, and I can sing an Elvis song, you know, like Ain't Nothing But a Hound Dog, right? I'm not going to do it right now. But let's just say that my wife and my kids and my in-laws were all doing karaoke, scoring, you know, 70s, 80s. And they said, come on, Ara, try it. And I said, no, I'm terrible. Just do it to see how bad you are, you know. I'm sure they expected like in the 20s. So I said, put on Elvis, Ain't Nothing But a Hound Dog, right? I scored a 98, the highest score of all. Of course I knew I was going to do it because I know how to belt out a few tunes, you know. But if I had to sing anything else, it would have been down in the 20s, I'm sure. And so from that day on, anytime yeah. From that day on, when my wife gives me a hard time now about how bad my singing is, I just say, hey, who scored the 98 on the karaoke machine? Who did? Right? And she just shuts up. She has to shut up. But I knew that machine had to have a scientific way of analyzing the voice, looking for highs and lows, right? I mean, it's not that expensive of a machine, maybe a couple $100. So I knew that it had a program that was quite simple, looking for variation, alteration, synchronization. So I just used what I knew about computer voice stuff, and I made my voice sound the way it should sound, even though it still sounded terrible, by the way, and scored that 98. I'm very proud of myself for scoring a 98 on that. It's one of those things you carry with you yourself to the grave, you know? Hey, I scored a 98 on a karaoke machine, singing an Elvis tune. So everyone heard the news, Olivia Newton-John passed away, huh? I think Olivia Newton, wasn't Olivia Newton from Greece?
Yeah, Olivia Newton-John. Yeah, the woman.
Yeah.
Yeah, she played Jackie.
I know, but she had some cancer, breast cancer. Poor thing.
Not Jackie, Sandy from Greece.
Huh?
She played Sandy from Greece. My bad.
Sandy.
Yeah.
That was, yeah. I mean, what if you've never watched Grease, the movie? If you haven't, and you don't know who Olivia Newton-John is, that was one of the best musicals ever made.
I saw it on Broadway. It's great.
With John Travolta?
No.
Oh. Yeah, but you've seen the actual movie, right? The actual movie is really good. I think so. When we were kids, growing up in California, my sister and I, we must have been 6, 7, 8. That's all we played was the Grease album, you know, on the record player. That's the only record we had growing up, was Grease and Fiddler on the Roof. But that was an 8-track. That was the only, I didn't have a radio in my car in high school. I had an 8-track player. Huh? Well, I had a radio, but it was busted. The antenna was busted. It was an AM FM radio, but I couldn't get a single channel, and I had an 8-track player, and I had one 8-track, and it was Fiddler on the Roof. So, growing up, all I heard was Fiddler on the Roof every day, going to school, coming from school.
That's my favorite musical
Is it
ever.
really?
Yeah, I was actually in the play in senior year of high school.
That's awesome.
Yeah.
I love it.
Yeah.
It's one of my favorites of all time. I just love it. I know all the songs. I sing them. And you don't want to hear me sing. So you better start asking questions. Or I'm going to sing Matchmaker, Matchmaker.
We can duet.
Yeah, right? Yenta.
Yenta.
Or Sunrise, Sunset. When I got married, my mother played Sunrise, Sunset.
Really?
And, oh yeah, and we danced to Sunrise, Sunset because my father wasn't there. My father had passed away when I was younger.
Wow.
Sure. All right, folks, we are just about done. We've got 5 minutes left. This is our last surgery for the day. And we've got 4 more surgeries coming up on Thursday. Thursday will be a big day. Big day for some of us, not a big day for others. If your name is Joe, it won't be a big day.
I need 30 strips, pencil, please.
Henry, where did you grow up anyway?
I was born in New York on Long Island. Then once the Great Recession hit in '08, my mom took me down to Florida, and I've been living here for 13 years, give or take. Yeah.
When you said recession in '08, I'm thinking 1908?
No, in 2008.
Right.
Yeah.
What were you saying, Dr. Byrne? Is it? Yeah. Did you guys have family in Boca?
Actually, yes. My grandparents and we had a bunch of family friends and all that lived down there. And yeah, we grew up there.
Nice.
We were a huge part of the Jewish community, and yeah, like it was cool. But I'm glad I'm out of there. I'm happy where I am in Melbourne.
I have to go to the Breakers Hotel this weekend for a meeting.
Oh, no kidding. That's the. Is that the big pink building?
I've been there, yeah. Has that fish tank thing, bar. Yeah. What was that, Henry?
Is it that big pink building in Boca?
Yeah.
Yeah. Okay. Yeah.
Yeah, I'm going there for a neurosurgery meeting. The Florida Neurosurgery Society.
That's the place to do it. I love that hotel.
Annual meeting. Kind of a waste of time going, but I need the CMEs. Say hi to my old buddies who have done absolutely nothing of significance in neurosurgery besides pad their wallets. God, I hate hanging out with neurosurgeons. They're so boring. Seriously. And they're all idiots because they wear suits to all these meetings. I go with shorts and a Hawaiian shirt. They're all in suits and ties. I'm like, screw that. You know, when I was a resident, I did that. Now I don't mind sticking out because I don't want to be associated with that sorry bunch. But I do need my CMEs. You guys have all been wonderful today, except for... Just kidding.
I was ready to
That's my
take.
favorite thing to do.
Was ready to take the heat.
Except for, and then everyone's like, who's he going to say? All right. Ask your questions, type them up. I'll be happy to answer them for you. Where's the betadine, my friend? We've just finished the bilateral L5-S1. It was a 10 out of 10 pain for this young lady. So I think she's going to be real happy with the results. And then the 4-5 was on the left. We did that as well. That went well. And I'm very happy. Today's surgeries all went well. No complications, no issues. Hopefully we'll have happy patients. I know one person who won't be happy. Joe. Anybody know Joe's last name? Schmo. Joe Dirt. That's it, Dirt. You're right. That's better than Joe Schmo. Joe Dirt. Yeah, Joe Dirt. That's about right.
There are a couple in that over there.
All right, folks, type up your questions,
Yeah, you see that over there? There are two.
and I will be happy to answer them for you. Can you see the incision
Yes.
right here?
Oh, okay. Yeah. Yes. That one. Yep.
7 millimeters, folks. 7 millimeters, right there. We did 2 of those, one on the left, one on the right. We were able to fix all 3 areas with those 2 little incisions. Great job, everyone, today. And it's 5 o'clock. It's quitting time. All right, type your questions up. I'll come answer them for you. Thank you, Luis. Thanks, everyone. Great work today. Let's keep track of those time points from now on, okay? I like to see stickers. Huh? Yeah. Yep, that's when I walk away, that's when you put the surgeon out. That's when my clock ends and Dr. Berndez's clock starts. No complications. I'm going to call the blood loss 2 mil. No, it was actually 5 mil. 5 mil. Now he cares. All right, type up your questions. I'll be happy to answer them. All right, so now you've had the surgery. How are you doing today?
I feel awesome. I mean, the only pain is, surgery site pain, and that's
Okay.
it. No nerve pain.
So the pain that you had before the surgery is
Gone.
cured.
Gone. Yeah.
Awesome.
Yes, that's amazing.
I'm Dr. R. Deuk Majan with the Deuk Spine Institute, and I'm here with one of my patients who just had the Deuk laser disc repair on her lower back, and she wants to share her story with you. Now, you came to Deuk Spine Institute because you were having back and left leg pain for how long?
The terrible left leg pain, probably about 2 years, but prior, I've had issues since I was 14 years old. So it's been a lot of roller coaster pain since then.
So you've had back pain since you were 14. You're clearly not 14 anymore.
No.
And so that's like 15, 20 years, right?
Yeah, too long.
And so why didn't you get it fixed sooner?
Well, the doctors when I was younger didn't want to operate. They wanted to, I was young. They didn't want to take a chance because all the surgeries then at that point, there was just nothing there that wasn't going to be traumatic to my back and my spine. So I went through physical therapy, shots, decompression. They did that and nothing was really working. And then it eventually kind of got better, and then it would get worse, and it would get better, and it was just up and down, up and down.
Up and down. And the reason it got better was the inflammation from the injury to your disc started to get better.
Yeah.
But then you'd have another herniation with activity, and then it made it worse. So
Yeah.
when we were in there, and you can see from this video right here that we were pulling out lots of big fragments of disc herniation. You probably over your lifetime from 14 until now had at least 10, 20 different episodes of herniation, and that's what we saw when we were inside there.
Mm-hmm.
All right, so now you've had the surgery. How are you doing today?
I feel awesome. I mean, the only pain is, surgery site pain, and that's
Okay.
it. No nerve pain.
So the pain that you had before the surgery is
Gone.
cured.
Gone. Yeah.
Awesome.
Yes, that's amazing.
Now, you're not from Florida.
No, I'm from Ohio.
So you traveled from Ohio to the Deuk Spine Institute in Florida. Why did you come all the way down to Florida?
There was nobody near us or anywhere near us that had any other option besides either getting a discectomy or a laminectomy or a fusion. There was just nobody was doing anything else. And I knew I didn't want to do that again because I'd already had that done. So it didn't work. And
Didn't work.
I had a really amazing physical therapist that connected me with you, and the rest is history.
Yeah, your physical therapist found us and was intrigued with the surgeries we're doing here
Yeah.
and sent you here.
Mm-hmm.
So what are you going to tell your physical therapist? I call him Dr. Salinas. What are you going to tell him when you...
Oh man, I mean, I've already told him. I texted him the minute I got back to our Airbnb. I said, I feel amazing, and I can't wait to tell all the rest of the patients in our Facebook group, like, this works. So
It does. The Deuk laser disc repair really does work. Well, is there anything else you want to say to your fans out there or friends?
my fans and my friends, thank you for praying. Thank you for believing me. I think that's one of the biggest things. There's a stigma around back pain because you can't see it, that people are just faking it, or maybe they're babies. Like, why can't you just deal with the pain? And it overwhelms you. And so to come someplace that believes me and then fixes the problem, and now I'm sitting here and I can be like a fully active mom. So I'm just beyond thankful. Thank you.
Yeah, chronic pain robs people of their dignity and their happiness and joy in life, and also their loved ones, the people that care about them,
Yeah.
because they suffer with you.
Yeah.
Yeah.
A lot.
Well, congratulations and praise God.
Yes.
You found us,
Thank you very much.
and I think you're going to do fantastic.
I'm looking forward to being strong again.
Awesome. All right.
Four, 3, 2.
Okay, welcome to the end of our live stream of Deuk laser disc repair, done for 2 discs at the bottom of the spine in the lumbar area. Those discs are the L4-5 and the L5-S1. And just to give you an idea of what I'm talking about, this patient's had back pain, and the back pain was localized right above the butt crack, right in this area, right here. And I know from experience, based on all the years of treating this back pain and curing it, that I saw on the MRI a problem with that disc right there, L5-S1, and a little herniation at L4-5. Now, it lined up exactly with where she was saying her pain was. And best of all, at the L5-S1, you could see the disc herniating out on the left and right, just where the nerves are coming out of the spine. So if you look here, it shows you 2 bones, a disc, and there's a little herniation right there. You can see that yellow nerve. That's the nerve that comes out and goes down the leg, sciatic nerve. And the herniation on the left and right was hitting on that nerve. So she was complaining of back pain going down both legs. I knew if at L5-S1, if I went on both sides, because it was bulging out on both sides, I could hit both of those herniations, clean up the tear, get rid of the back pain, hit the herniations, get the pressure off the nerves, clean up the leg pain, and then the L4-5 on the left side, there was a small herniation. I wasn't 100% sure about the 4-5 based on the MRI, but her pain was definitely just above it was L5-S1 and L4-5, so I kind of suspected it. I saw the small herniation on the MRI. I put 2 and 2 together. I said, we need to do it. When we got in there today, you could see that disc was like a grenade, just blowing. and all that pressure inside the disc from inflammation. So as soon as we got the dilator in, that disc material literally pushed itself all the way through that tiny little tube, literally 0.5 millimeter, squeezed all the way up that dilator and out the other end, literally shot out the end. That thing was under about 80 millimeters of mercury pressure. We don't normally see that. That's the first time I've seen it under that much pressure. That said, that explains why that disc was so inflamed and painful for her. When we tested it, it was a 10 out of 10. So I didn't expect it to be a 10 out of 10, but it sure was. When we got in there, I saw the tear. We cleaned up the tear. It was a small tear. Didn't see it that well on the discogram, if you go back and watch. But when I got it cleaned up, there was a tiny hole left. That will seal off real quick. Overall, surgery was very successful. We lost around 5 cc's of blood. That's around 100 drops of blood for those of you wondering. And didn't have any problems, so she's going to be here for about an hour and then she's going home. The first 2 surgeries are already gone. They've gone home and they're both doing very well. All right, any questions?
Yes, we got one from Brian Johnson on YouTube.
Brian Johnson on YouTube.
And he went, if insurance doesn't want to pay, do you offer any financial plans? Sorry for the million posts today, but a nice job and another successful surgery. Don't be sorry, Brian.
Thank you, Brian. That's why we're here. We're here to answer questions. The nice thing about it is that when I answer your questions, everyone watching from today going forward for 1,000 years will get the answer. And that's why I love doing these broadcasts and recording them and keeping them in posterity. We chose YouTube primarily as our main platform because, let's face it, YouTube's going to be here for another 1,000 years plus. People will be traveling to Mars and will be watching YouTube videos someday. And so hopefully they'll be watching these videos to learn about how we solved the riddle, the puzzle of back pain and neck pain in the year, well, it was actually 2008 when I first started doing these things. Actually, it was 2006 when I first started, but 2008 was when I figured out, the cause of the pain in the back of the neck was related to the tear in the back of the disc. And of course, we published in 2012 Deuk laser disc repair in the Surgical Neurology International, and that's where we presented our first findings, and then we published again on the Deuk laser disc repair, and then again and again and again and again and again. So we've published over 10 times now, and the key is the tear in the back of the disc is the cause of the pain in the back or neck when it comes from a herniated disc. That said, let's get back to the insurance question. Insurance companies are businesses, and they've led the public to believe that they're for the good of the public, okay? And I have to say, in a way they are. They are, because what they do is they help you lower your costs, but then they don't pay the bill they're supposed to pay, and they leave the patient stuck with it. The number one reason for bankruptcy in the United States of America, do you know what it is?
The number one reason.
Unpaid medical bills.
That was
Unpaid medical bills. And it's been the number one reason for bankruptcy for the last 20 years. Now, why? Why would people have unpaid medical bills? Folks, it's not because they don't have insurance. These are people with insurance, and their insurance is not paying their side of the bill. Hospitals are suffering. Doctors are suffering. We cannot do surgery for free. It kills me to have to ask people for money. Period. Kills me. I hate it. But when the insurance company won't pay and the patient can't get their insurance to pay, we cannot run this facility without money. And I haven't gotten a check from Elon Musk or Bill Gates yet, or Tiger Woods, or anybody with real money to support this, though it should be funded. It should be raised awareness around the entire world, because there are people dying with chronic back and neck pain, dying. Go on Facebook and read their posts. They say things like, I'm in so much pain, the medications aren't working, the shots didn't work. I can't see myself living this way. And they're literally killing themselves. Suicide is real, and it's happening for people with chronic pain. And it is a shame that we could prevent it, we could stop it, we could avoid it in all of these people, but the insurance companies are so freaking greedy. Do you know what United Healthcare's profit was the last quarter, the last 3 months? It was almost $6 billion. That's one insurance company, $6 billion in 3 months. That's over $20 billion a year, folks. And I'm going to tell you something. That's the profit they declare. They're not even declaring all their profits. No. Let me explain it to you. Let's say I made $1 million last year, total. Collected $1 million. And my profit is really, it's 500,000. Let's say 50%. But I don't want anyone to know it's 500,000. What they do is they can hire a janitor company to come in and clean the building. Now, the janitor should charge 50,000 for the year, but they own the janitor company and they're going to pay the janitor company $500,000. They're basically paying themselves $500,000, but guess what? The janitor company payment is not regulated by our government. The government doesn't see that janitor payment, that overpayment, as a profit to the insurance company, because it's not. It's a cost of running the business. But it's a ridiculously high cost, and they are basically funneling money back to themselves through the janitor company. Okay? Paying them $500,000, 10 times more than they should pay them. So it's a way of pulling profits out of these insurance companies through subsidiary companies, the janitor company, that they own. And that's unregulated by our government. Our government regulates the profits of health insurance companies. They're not allowed to take home in profit more than 10%. All right? It's called the medical loss ratio. And the way they hide their profits is in subsidiaries, companies. All right? The company that makes coffee for their employees, the little coffee shop downstairs, that they may spend $50,000 a year on coffee, but they pay the coffee shop $5 million because they own, the guys who own the insurance company, the big money makers, the ones behind the scenes, the ones that are hidden out of the public view, they own the coffee shop, they're paying themselves $5 million basically. So they're diverting money out of the healthcare system into their pockets. And the politicians, the regulators, the auditors are all allowing it. They're turning a blind eye because they're getting their pockets lined too. So folks, don't blame me that your insurance doesn't pay for the surgery. Thank me for spending the time to figure out what's causing back and neck pain and developing a treatment that works. I invested my own money. I literally took out $10 million in loans from the bank. I paid it all back over the years, and I took all that risk. I put my family and my livelihood at risk of defaulting on loans just so I could buy the equipment, train the people, build the building, and have this available. So yes, I empathize with you, but at the same time, I want to help you, but this is your fight with the insurance company. You must fight your insurance that you picked and you paid to cover your benefit. So how have we set things up? We are prepared to help you. How? I have found the very best lawyer in the world to fight these insurance companies. Actually, 2 of them. And one's in Florida, one's in New York, and we're working together. We're building a plan and supporting document. I've got a company out of Seattle. I've got another neurosurgeon out of Seattle. We've got an incredible team, and we're about to go to battle for you guys. All right? So that we can make the Deuk laser disc repair endoscopic procedure common, available everywhere, covered by insurance. And if it is, then all the surgeons will do it, and then you don't have to come here and get it done. Because the way I see it, there's around 10 million people right now that need this procedure. And even if I drank Red Bulls every day, I wouldn't be able to fix 10 million people. All right, so I need help, but nobody wants to do the surgery because they're not paid. Okay, so we need to fix this problem, and I'm committed and dedicated doing it. That's what this broadcast is supposed to help us solve. So I'm sorry your insurance may not pay for it. We don't do financing, but what we do is this. The surgery may cost $100,000 charge, let's just say. And patients will have to pay a deposit up front. I don't know what it is, $20,000. And then the rest, we bill your insurance. We don't come after you for it. So that said, I'm using example numbers. Everybody's cost is a little different because everyone's surgery is different. But that's the best I could tell you.
There is no questions left, but Brian did respond to what you were saying. He's like, what's crazy is that they will pay for cheap procedures all day long for a patient, but will not pay for a more expensive procedure that will exactly fix that patient.
Yeah, right. So they will pay for cheap, shitty procedures because they have to pay for something. And, you know, if they don't pay for anything, they are going to get in trouble. Literally, they will get in trouble. There will be riots in the street. Okay, so it's all psychological. These insurance companies have the best lawyers. They have the best psychiatrists. They have the best business people, the best actuarials. They got the best of everybody. And what they're doing is they're serving you a shit sandwich, and they're convincing you that it's a steak that you're eating. Because when you actually stop and look at it, you realize what it really is. Okay? So yes, they'll pay for microdiscectomy and laminectomy usually. They will also cover fusion in some cases because they know that people won't do a fusion. If you tell 10 people they need a fusion, only one will get it done. One person's desperate enough. So the insurance companies know that they'll allow the more complicated surgery like fusion to be covered as long as you meet their extensive criteria, because they know people won't do it. But when you have a simple, safe, outpatient, 1-hour procedure, fixed today, the rest of your life the pain is gone, my God, they know people are going to want that in droves. They're not stupid. They already know about the procedure. They have their people on it, but we're going to kick their booties. Okay, mark my words. I have been planning this for 15 years. We have put all the cogs in place to take on the Goliath, the bully. And we're doing it for you, really, for you guys. I could easily retire and go to Europe and just live in Europe with my wife and be happy. But every day I'm in Europe, I would be thinking about all the people that I left behind that are suffering every day in pain that I could have fixed. So I would not leave to Europe with a good conscience. So I want to finish my mortal toil with a good conscience. That's the way I was brought up by my family. I want to do what I can. I'm not a lazy person. I love working. I like working hard, and I like helping people. That's why I went into medicine. Unfortunately, I wish more of my colleagues felt the same way, but they don't.
That is it.
All right, that brings us to the end of our broadcast. I'm glad you all stuck it out. Go refresh your